Hi, I'm Tiffany Brown-Bush, and I want to welcome you to day 10 of the 14 days of fat loss. It is flying by, and today I want to jump right into the topic. It is twofold. I think I mentioned that I wanted to just discuss insulin yesterday when I did the cortisol video for you, but I want to see if I can't tackle both insulin as well as Candida overgrowth, because I just continue to run into it in my practice, and people that I work with who are really struggling with cravings just have no clue how so many of these different things tie into each other. So from a fat loss perspective, when it comes to insulin, what I want you to understand is that I think people understand because of diabetes that when blood sugar raises or increases, right, due to the consumption of sugars in the system, that is going to make it more difficult to perhaps release fat, because the body is going to be burning the sugar that is available, okay? What is less understood by just, I think, regular population is that what also happens is that when blood sugar raises, so does the insulin response, right? Because the whole point is, as blood sugar is increasing, the body is releasing insulin to make use of that blood sugar to store that sugar, so it's just not in the system, right? So the problem with that is that in the face of insulin, fat loss does not occur. Right? So if we have an insulin response in the system and insulin is activated, the hormone is active, you're going to have a problem at that point because of the way that the hormones work with releasing fat from the cell, right? It doesn't work. And so if you end up in a situation where, like I was talking about yesterday with the cortisol response, where your body's pushing out sugar and it's pushing out sugar, even though you're not even consuming a lot of sugar. Now, God forbid, you are stressing out a lot and you're consuming a lot of sugar in your diet and alcohol in your diet, you're going to have a big sugar response in your body, right, in your blood sugar, and you're going to have a high insulin response in your body as well. So what you've just done is we have this twofold problem of too much sugar and too much insulin in the system. How is the body ever supposed to go into stored fat? Why would it ever need to release stored fat? How could it ever release stored fat? And therein lies the problem with the hormone insulin, okay? Now that's an oversimplification because I need to get to Candida, but I want you to understand that part of my job when it comes to belly fat specifically, resistant weight loss, is understanding that yes, we have glucometers and we can test when the blood sugar is up, right? We can test blood glucose, but there is not an insulin meter. So there's not a great way to test insulin short of going and having blood work done. And you can ask for this. It's not standard practice, but the dead giveaway that there is an insulin problem is looking and seeing if there's a good deal of midsection fat, right? So if the body is storing fat in the middle, the midsection in the belly, you know you have an insulin resistance problem. You know you have an insulin resistance problem. And if you're curious, take this video as a moment to kind of motivate you to just Google and learn about insulin resistance, but it's a huge hormonal player when it comes to fat loss. Things that you can do to help you is to keep your diet lower in sugar, keep your experience lower in stress, and do things that help you be more insulin sensitive. So I have clients include things in their diet like cinnamon, or I use a host of different supplements that will make them more sensitive, insulin sensitive, as well as special fibers. So increasing fiber intake, using fiber in your shakes, using fiber on your food, eating a very high fiber diet. But I'll also use some supplementation to make my clients more insulin sensitive, and specifically trying to target the fat loss in the midsection specifically. Other things, and the kind of exercise that you're doing. So if you fit the category of yesterday and you fit the category for today, you have to be very careful with the intensity level of the cardio that you do. And I was telling somebody recently, part of the problem I find is it's HIIT, and then it's slow low cardio, which is what I call it, and then there's all this aggravating stuff in between that people will do. And you'll see this with a lot of the cardio class instructors, particularly is it's just like what's going on with your metabolism where you're holding on to all this extra body fat. You know, you can see aerobics instructors that can teach tons of cardio-based classes and dance classes, though they seem themselves to have a hard time with actually releasing fat, and or people who run a lot, but they run in this kind of middle of the road phase. It's not super challenging, but that's not in a fat burning zone, and all of that creates this space here creates this really funky inflammatory response in the body, and it also does not help with the insulin resistance piece. It creates more of an insulin resistant response. I hope that's helpful. I know that's a lot, but this is the hormonal aspect of fat loss. Briefly, a lot of people will come to me and they'll have, I do a lot of gut restoration as part of my functional medicine and naturopathic practice, right? So part of my training has been, and again, partly because of my own struggles with digestion and all that, understanding the need for probiotics, having a lot of just digestive distress and problems can mean that you have something like a Candida overgrowth. Now, that is not the only issue. So what I will say to people is a good probiotic can really help you when it comes to fat loss. And because I don't have time to get into it in this particular video, I want you to consider probiotics as a fat loss strategy, because an overgrowth of Candida in your gut can cause all kinds of digestive problems, but also increase the likelihood that you're going to store carbohydrates and things that you're eating. To add to that, if you have dandruff, if you experience vaginal yeast infections, thrush, so yeast and overgrowth in the mouth, and I'll get that with people who come to me, and they look like very normal people, by the way. Thrush isn't this crazy, just disgusting thing that happens. Regular people can develop thrush, athlete's foot, other places that, you know, lots of gassiness and bloating, but yeast can show up on the skin. I'll get people with skin irritations and things like that in different places, and it's all yeast. You will have higher cravings for sugar and carbohydrates when you have a Candida or yeast overgrowth in your body, right? And you will most likely have a more labile experience with your emotions and have more of an increased likelihood of anxiety. All right, so this is why I do integrative therapy, because all of these things pull together, and there's no one thing that's separate from another. And if somebody tells you that it is, you might want to find somewhere else to go. So it all pulls together. And so with that being said, is when people come in and I'm dealing with what is supposed to be an eating disorder or compulsive eating situation, but that person's also got digestive complaints, and they've complained of chronic sinus infections. That was the other one, and ear infections, and just all the other things I've listed. I start thinking, you know, some of this may be some organism in the body that's driving this compulsion for sugar and carbohydrates, which is sabotaging their ability to lose weight, which is sabotaging their fat loss attempts, right? They can't stay on a program because they've got all this stuff that's going on in their body. So I'll start having conversations about that. A lot of the times people have to fill out a lot of questions with me, questionnaires with me around Candida, because I don't want to be mistreating. I don't want to diagnose someone as having something and be treating the wrong thing when it's actually a yeast overgrowth in their body. And it's amazing what will happen when you get rid of that. So things around a yeast overgrowth, you need to starve the yeast, right? You need to kill the yeast, and you need to replete the good guys. So you need good, healthy organisms in the body. And so there's a multi-step phase program that I do with people when I'm tackling all of this from that perspective. There is a Candida quiz on my website on www.tiffany'sfitforlife.com, and you can go there, you can complete it, and you know, if all these things sound like you, and then that quiz has just got you like, wow, this is me, reach out. You know, because this is a little bit more complicated. You can go to your doctor and you can get antifungals. They will give you things like that. But a lot of times what I find is that they just do the killing phase, and there's no repletion, and you will find yourself in a chronic phase of continuing to get problems and infections if you don't replete and you don't change the diet. Okay, so much longer video than I had wanted to make, but I knew I was trying to tackle insulin and Candida at the same time. Okay, I'm going to go more into the psychological aspects of fat loss a little bit tomorrow, as we're talking now about how Candida can impact the brain and really change how you feel. And mostly I want you to kind of keep in mind too, the gut and the brain talk to each other via the vagus nerve. So whatever's going on in this gut is going to also be going on in your brain. So inflamed, unhappy gut, inflamed, unhappy brain, mood disorder. So, and this is all tied to fat loss, right? So I'm going to get going. I want you to stay fierce, fabulous, and fit for life. I hope you're enjoying the 14 days of fat loss, and I will see you tomorrow.